So just one sec and I'll let you know.
Okay, sure.
So just one sec and I'll. Okay, ready? Shahzad, शुरू करें.
The PS of the minister was calling. I think he's logging in. Is he here?
I'm here.
Dr. Faisal is here. Okay. So, Parveen, can we start now?
Yes, please, yeah.
I can't hear you, Parveen.
Yes, please. Can you hear me now?
Okay, Bismillahirrahmanirrahim. Assalamu alaikum, everybody, and welcome to this webinar on future of public health challenges and opportunities in Pakistan. We are joined by senior level public health professionals, and the chair for today's session is Dr. Faisal Sultan, who's heading the Ministry for National Health Service Regulation. He's a special assistant to Prime Minister, medical doctor, and a very senior consultant, and a long history of contributions in Pakistan, of establishment of doctor sort of hospitals and a lot of other sort of entrepreneurship activities in this country. Before going on to the other discussions, I will immediately go to the chair for his remarks, because we are lucky to have him actually, because today there was a lot of political activity, and he was busy in parliament as well as in his office. So, but because of this, he said it's important that he joins, and he is with us. So over to you, Dr. Faisal. Thank you very much for joining us, and it's over to you for your welcome remarks and your comments on this topic.
Thank you very much. First of all, I'm really grateful to you for your very kind words. It's very encouraging to hear this, and a lot of it is undeserved praise, but I will take it as something happy. Thank you. Now, first of all, it's really great to have all these advocates for a strong and resilient public health system in Pakistan right in this event, both from within Pakistan and from our very rich diaspora. So this month really marks a whole year since we started to prepare for the pandemic that we are currently going through, and we started to respond to it very quickly. And the events of the last year actually have shown how important it is to have a strong public health system. And I think societies around the globe have really figured this out, perhaps, once and for all. Maybe this was a 1 in 100-year reminder. But before I, go into some detail, I'd like to step back and sort of look at what the grand plan has been for health in Pakistan. So the Prime Minister, Mr. Imran Khan, has repeatedly pointed out this commitment of investment into the social sector, especially with health as a top priority. And these just not have been words alone, and it has been demonstrated by investments into the health sector, which is really unprecedented in volume and quality. So the National Action Plan on Health from 2019 to 23 is in line with strategic priorities of the federal health government, which include things like advancing universal health coverage, protecting people from health emergencies and disease outbreaks, promoting a healthier population, and effective organization for a better health system. Now, so what are the manifestations of these? Let's take a look. So first of all, the government established unprecedented coordination mechanism for COVID-19. I think if there is one definer of our response, it has been this coherence in terms of how we have responded to this enormous challenge against COVID-19. And this is despite having a very fragile and not very strong health system, low health spending overall, and a huge shortage of the health workforce. And yet we've come out of this so far by the grace of God, much better than what some of the gloomy predictions were set to show. So this shows that with great political will and determination, it is possible to overcome crises with less investment, but with better organization. Now, it has also shown us that while we did okay, but it is not enough to be reactive, and we need to permanently strengthen the health system to be able to cope with things without having to build it once we go as we are going along. So the aim is to increase public health spending to 5% of the GDP by 2023, and strong partnership on the shared commitment for universal health cover is critical for the well-being of the people, especially in the most marginalized and vulnerable of populations. So in this context, the essential package of health services, which was developed through a consultative process, and this is lined with DCP3. This includes a very strong emphasis on family medicine. Now, as part of the whole reform agenda, one of the most important things was to reform some important key regulators in the Federation. And one of them was the Pakistan Medical Dental Council, now called the Pakistan Medical Commission. And we've tried to bring it in line with modern practices of how a regulator of medical education and physician licensure is. We've also introduced the Medical Teaching Institutes Act at the Federation, right now in the form of an ordinance, an executive order, but it'll become, inshallah, law in a few months. And the idea is to govern our public sector hospitals better. Then, very importantly, the National Institute of Health, which has been a signature institute as far as the Federation is concerned, but I think it has required a revamping and a redo. And now with a new CDC in it and a new health data center and a health research facility right into it, this is another important milestone that we've already achieved part of, and you will see more of this in the coming weeks. There are other major reforms in the pipeline, including the Drug Regulatory Authority of Pakistan, as well as some others. Now, beyond the focus on strengthening of the health system, we're also working on some targeted large-scale programs. I'd like to highlight two of these. First of all, we want to make a serious dent on the tragically high ratio of malnutrition in children and women in this country. So we have specific interventions, science-based, covering 40% of the country in high burden districts. This has been approved by the Council of Common Interest. And I think this is going to be, inshallah, high cost but high impact intervention. And this is very, very, I think this will be a signature program of this government, especially because the Prime Minister started his inaugural speech with highlighting this issue of malnutrition. The other problem is a grave shortage of healthcare workers. And when we talk health professionals, very often the focus goes to physicians, but we all know that you cannot do this without a lot of support from so many of our health worker colleagues. And so nursing is one of the highlights in this, in which we have such a low density and such low numbers that short of a very major disruptive intervention, we are not going to have the kind of nursing capability that we require. So the current number is about 110,000 nurses, which needs to go to 900,000 by 2030. And the quality and job opportunities for health workers is not aligned to the future need of the health sector. So we are finalizing and nearly done with creating a program for boosting nursing education. It aims to intervene in two important areas: faculty development, and this help will extend to all provinces, as well as development of the physical infrastructure in nursing schools. And we do feel that it will seriously change the inflection, create an inflection point, change the trajectory of the production of capable, smart, and well-qualified nursing professionals in Pakistan to cater to our needs and to bring up the health system. And so finally, as we on our way, inshallah, to see the end of the pandemic by the end of this year, hopefully, we've made some important strides in digital innovation for public health. And this includes the data center that I mentioned in the NIH, as well as a rollout of important digital initiatives. One of them, of course, very topically and very currently relates to the rollout of vaccines in Pakistan. We do think that the software platform that's been created will help us to have a smooth, orderly deployment of the vaccines, inshallah, perhaps as early as next week. And so this investment into healthcare and its organization will pay great dividends. Once again, I'm extremely grateful to you for accommodating me and to adjusting around my schedule. Otherwise, I would have adjusted around yours, but in the present situation, I'm grateful for your understanding to allow me to do this and to allow to speak to you. Thank you very much.
Thank you, Dr. Faisal. So kind of you. We have a very sort of big group with us, and we will be interacting with each other. And the whole sort of output of this seminar and webinar will be shared with you in the form of a brief. And we will be working on some system level frameworks. So hopefully this dialogue, which we started today, and thank you for honoring us, we will be taking it forward for the future interventions in public health. Thank you very much. Thank you, sir. Okay, take care. Naveed, Dr. Naveed, can I request you to please invite the British High Commissioner here, Stephen Turner, because I think he's here. Naveed Sayed.
Yes, I am, Dr. Shazad. So good afternoon to you. Good afternoon, Dr. Faisal. And let me say in my best Urdu, मैं बहुत खुशी है कि आज आपके साथ हूँ. I'm really pleased to be with you all today.
Thank you.
I don't want to speak for long because really today is a chance to hear from all of you. It's wonderful, actually. One of the things we've learned in this pandemic is the ease of getting together like this. But really, for me, three reasons I wanted to say hello and join the start of this conversation. The first is actually a message to all of our friends at Upsign and the support for what you do. I was made aware very early on my time in Pakistan of this network. I think it's incredibly powerful. We talk a lot, Dr. Faisal just mentioned the importance of the diaspora. We talk about partnership between the UK and Pakistan that I'm privileged to sit in the middle of how we need to change perceptions of Pakistan, and the best way to do that is working together to build potential. So it was good to speak to the Upsign annual meeting the end of last year, and I want to carry on supporting efforts such as these as part of our signal of the friendship close friendship between our two countries. The second reason I wanted to join you is really to recognize much of what Dr. Faisal has just set out, that I think the path of COVID so far in Pakistan has really been a success story. Huge challenges like all countries, probably two peaks we describe it so far, and the vaccines bring promise of reduced burden on the health system and this disease in the future. But I think Dr. Faisal was being very modest about his leadership. He and I have had the pleasure of getting to know each other better over the past year. Dr. Sanya Nishtar, who's I think speaking to us shortly. It really is remarkable to have professionals such as these leading and shaping Pakistan's response. And I think that coherence, that coordination Dr. Faisal was describing, the leadership required, has been absolutely vital in helping the country navigate, like all countries, these extraordinary times. So with that, the third reason really is that I think it is therefore absolutely right that we are supporting and focusing, and the British High Commission will do its part of that, on the future of public health in Pakistan. And I am probably the worst person on this entire call to comment. I'm a diplomat. I'm least qualified to talk about these things, but I have had to learn the hard way this year that when we talk about health, it's not just about hospitals and doctors, it's about systems. We've learned the importance of epidemiologists and the data they need to inform decisions. We've learned about the importance of communications specialists and the messages needed to inform the public and behavior change. Of course, how that links directly to basic water and sanitation so public can respond to the messages they hear. In all of that, the complexity of making sure different sectors work together, respond together, health, education, media, disaster response, religious leaders, I think that's much of the coherence and coordination Dr. Faisal was talking about. Reliable information and disease surveillance systems, And then I strongly agree with Dr. Faisal on building the skills and the capability. And I'm really excited about some of the work we're doing together to expand nursing education and nursing capacity in Pakistan. So put all of that together. In short, what I'm saying is, aapka kaam bahut ahem hai. Your work really is important in this area. And in short, you've got the support of the British government, the British High Commission, our brilliant team. Naveed there is a part of it. We used to call it DFID. It's now a part of FCDO, but it's still the same brilliant development network. We are ready to support Pakistan as it seeks to invest in and strengthen its public health systems and future. So thank you, and it's a great pleasure to have joined you. Thank you very much.
Did we lose him? I think the line dropped, I guess. Parveen, can you hear us?
Gigi, carry on.
Okay. Is he joining again or what?
No, he has finished. So now
Oh, I've finished, Dr. Shahzad. So back to you.
Okay, thank you. Thank you, Kitchen Dana. Good to see you. Parveen, now I think I'll request Dr. Zafar to take up this sort of moderation role, and hopefully we can have one or two discussions. He can have his own presentation, or we can wait for Dr. Sania. She said she will be joining in between. So over to you, Zafar. If you can take up, if you can have your presentation or whatever to save time, actually.
Thank you very much for that, Shahzad. I was just wondering whether we could show the presentation from the Pakistani High Commissioner.
Okay. Yeah, Parveen mentioned that. Sorry, yeah.
No, that's okay. It really follows on nicely from.
Okay.
I mean, just to say, it's wonderful to hear from Dr. Christian Turner that the support the British High Commission are giving around the public health and the health system and public health in particular. So we look forward to working with Dr. Christian Turner in the future. So it'd be nice to hear from the Pakistani High Commission.
Yeah, so we'll do that. And Dr. Asad Hafiz has just joined us. So maybe after this talk, Dr. Asad Hafiz.
Yeah, in that case, Asad Hafiz maybe
okay.
next.
So just bear with me, please.
Bismillahirrahmanirrahim. Dr. Faisal Sultan, Special Assistant to the Prime Minister on Health, Dr. Khalid Mahmood, Professor Jawad Dar, distinguished participants, ladies and gentlemen, Assalamu alaikum. I'm Hassan Zailam, Councillor, Pakistan High Commission, London. I am pleased to be a part of UPSIGN's seminar on future of public health in Pakistan. Pakistan High Commission is proud of its association with UPSIGN. We deeply appreciate UPSIGN's efforts to facilitate British scientists to partner with the Pakistani scientific community for mutual benefit of our two countries. I am hopeful that today's seminar would help strengthen Pakistan's public health sector through exchange of best practices and technical assistance. We must develop new networks aimed at solving Pakistan's health issues in line with the UN Sustainable Development Goals. The government of Pakistan has taken a number of steps to manage and combat COVID-19 pandemic. These efforts have received worldwide appreciation. The UK scientific community has played a pivotal role in the management of the pandemic and vaccine development. Pakistan's recent decision to grant emergency approval to Oxford's AstraZeneca vaccine is a testament of this success and our excellent relations with the United Kingdom. I look forward to hearing the recommendations of the speaker to suggest how we can create opportunities for better UK-Pakistan cooperation in health sector. I thank you all.
Thank you.
Gee, thank you. Parveen, Dr. Asad is here.
Hanji,
Okay.
Dr. Asad is already here.
Okay, I think we can start with the presentation of Dr. Asad Hafiz. Dr. Asad, can you hear us?
I think he's dropped off.
Okay, let me send him a message, and then he was also working over there for this vaccination thing.
So maybe Zafar can want to start.
Zafar, can you start, and I'll just call Dr. Asad, and then he can join. Okay.
You're mute, Zafar.
That's fine. No, thank you, Suzanne. I'm happy to, I mean, mine will take a little bit longer. I'm happy to, if Asad gets back on the line, I'm happy to wait for him to start.
I think if you can start, that's good.
Okay, that's fine. Let me just share my screen then in that case.
And it would be good if you could introduce yourself, please.
Yeah, that's right. Can you hear me? Can you see the screen?
Yeah, we can see that.
Okay, that's
good.
That's great. Well, I'm Professor Zafar Iqbal. I'm a visiting professor at Stafford State University, and I'm here today because I'm representing the Faculty of Public Health Pakistan group. The Faculty of Public Health is a member of the Royal College of Physicians in the UK, and the Pakistan group has senior members of the public health, as senior public health professionals working in the UK, and they're genuinely interested in supporting Pakistan in its work around public health. And we are keen to work in partnership with colleagues in Pakistan and support where we are able to. So that's my angle. And I was asked today to briefly talk about the UK public health system, and if there's anything we can learn from the UK public health system in terms of good and bad, and on sort of in terms of strengthening, informing the discussion around the Pakistan public health system. Just like to make it absolutely clear that we're not advocating any particular model. This is more about sort of learning from each other, and Pakistan needs to develop its own model based on the problems that it has and kind of where it starts from. And so in terms of myself, you can, I'll leave my final slide will have the details of the Pakistan Public Health Group on how it can be contacted. So I'm just trying to get down. Clearly, we can't escape from COVID, and many countries across the world are reviewing their public health systems. Pakistan is not on its own. The UK is certainly reviewing its own system, and Public Health England will be transformed into a new organisation which will strengthen its health protection response for future pandemics as well as the current issues that we face. I think it's a great opportunity for Pakistan also to consider its public health systems and to see how we can improve things in the future. A really good place to start is first of all to look at what future public health challenges Pakistan might face. This was a document produced by a group in the UK looking way into the future, 2040, and it outlines a series of important public health challenges the UK is going to face. In terms of Pakistan is going to be facing many challenges, from NCDs to COVID to new pandemics. There's going to be issues around antimicrobial resistance, lack of primary care, over-reliance on secondary and tertiary care, and obviously the huge demographic growth. And as the Pakistan minister pointed out, the malnutrition problem is a really, really important priority. So I think the good place to start is, from what the future challenges are. In terms of system working, these are some of the issues that that are really important from the UK public health system point of view. The UK system isn't perfect by any means, as we can see from our response to the COVID outbreak. And there's been, we've had successes, we've also had severe criticisms from many quarters around how we've managed aspects of it. But these are some of the things which I think have served the UK public health system well. And there's been many changes in the UK public health system. It was first of all in many years ago, it was in local government, then it moved into the National Health Service, and then it moved into the national, back into the local government and in the National Health Service as well as having a national specialist body. I'm just going to talk a little bit about the public health system in the UK, and one of the key things is that we have a specialist workforce, and which is a real asset to the UK system. A great deal is invested into the training of public health specialists and directors of public health, who are responsible both at the local and regional level for 3 domains of public health. Public health practice is divided into 3 domains: health protection, health improvement, and healthcare public health. And health protection is fairly self-evident. Health improvement, which includes social determinants, and clearly, with the health inequalities that we face in Pakistan, it's a really important area. And health services design is an also responsibility of public health specialists. The Faculty of Public Health is an independent organization. It's independent of the government. It's a membership organization, and it provides a home to around 4,000 public health professionals. And it provides standards for the practice of public health. I'll talk a little bit about the competency-based training. It's responsible for examinations, and it's also, because it's independent, it can actually provide that advocacy role as well, which is really important. In terms of the competencies, all public health specialists are appointed through a national system where the faculty has a role within it. And so every public health person practicing in the UK at the specialist level has to meet a certain standard, which is really, really important. And that ensures that the right people have the right skills for those jobs. So there is a national there's a national career pathway, and there are jobs at the kind of end of it as well. So the competency-based framework covers a whole range of issues, from health promotion, health protection, healthcare, public health, which I've mentioned, but it also covers research, public health intelligence, and a range of other areas. I noticed that Dr. Ziaul Haq, Dean of Peshawar Medical College, is also on the line. And last year, he held an international public health conference in Peshawar last year. And we discussed in one of the workshops what an exemplary public health system would look like. And this is one of the outcomes of that workshop, where we looked at what changes do we need to make to the workforce? What public health infrastructure do we need? How academia can fit into the public health system? Look at non-healthcare issues. Look at policy making and public health schools, and also, I think media and communications is really, really important, and that engagement with the general population. I've worked in the UK public health system for many years, and despite its many weaknesses, there are real benefits of working in a system. And one of them is that there is clear commitment from the top towards public health, and that's really important. For example, the Secretary of State for Health has a clear line of sight to the frontline health public health workforce. The directors of public health were appointed at the local level, not only have accountability to their local organizations, but they also have an accountability through Public Health England to the Secretary of State for Health. And that really helps to join up the national and local systems. And that's a really important element to it. I was just going to mention that, for example, in Scotland, one of the key questions that they're asking themselves is, what should sit at the national level, what should sit at the regional level, and what should sit at the local level. And I think that's a really important debate for Pakistan in terms of, in the ideal system, what should sit at the national level and what should sit at the local provincial level. That's a really important debate to have. When I was having a look at this talk, I had a look at a couple of some papers from Pakistan itself, and this was written by Fozia Rabbani, and she talked about the importance of schools of public health and the roles they play within the public health system. There was another paper, again from Pakistan academics, looking at public health education and health systems. And the clear conclusion they came to was that public health education in Pakistan falls short of meeting the current national challenges. And again, that needs looking at, particularly in terms of national public health accreditation. Dr. Faisal Sultan talked about the work the government is doing around the medical accreditation. I think the public health accreditation also needs to be looked at as well. This was a framework from WHO, again, in terms of developing a system for public health, again, we can draw upon. But I think Pakistan needs to develop its own system because it's got its own challenges. And in looking forward to this, I think it needs to be looking at, the future public health challenges, as I mentioned. It needs to be looking at, what kind of system strengths there are at the moment, what are the gaps at the moment from a system point of view, as well as taking in best practice locally and internationally. That we need a future public health vision. We need to be looking at workforce needs assessments, looking at standards, networks, regulation, governance, and clearly engagement with a wide range of stakeholders. I think these are really important questions for Pakistan to be considering as they map their way forward. Like I said before, I don't think we're not advocating a UK system. It's important Pakistan develops its own system to meet its own challenges. But there are many organizations such as Upsign or the Faculty of Public Health would be happy to work in partnership with Pakistan to support further system development.
Thank you, Dr. Zafar. Thank you very much. Now we have Professor Dr. Asad Hafiz, the Vice Chancellor of Health Services Academy with us. We will be uploading his presentation, and then Dr. Asad, can you hear us? Can you unmute your mic?
Ji, can you hear me?
Oh, yeah, please, clear. So Dr. Asad, over to you. We are just adjusting the slides. Yeah, you can start now, please.
Ji, Assalamu alaikum, and thank you very much for inviting me to this very important seminar. In the interest of my connection, I would not put on my video, so you would have to bear with me with my voice. What I'll be talking about in next 10 minutes is about public health in Pakistan, broadly speaking, the challenges and opportunities available. Can I have the next slide, please? Can I get the next slide, please? Dr. Shadad, can you hear me?
Yeah, we just moving. हमारे पास यहाँ से तो हो रही है, उस पे नहीं आ रही थी. Sorry.
Yeah.
So slideshow
Okay.
में issue था. Sorry sir, you can continue.
So इससे पिछली वाली slide पे, second slide. Yeah. So what I'll be doing, I'll briefly go over the health indicators. All of you know about that, but just to refresh a few, I'll briefly have an overview of the health systems in Pakistan, and then I'll spend some time on challenges and how to address these challenges in times to come. And this would be open for discussion and for your inputs. So we do all agree on this, that Pakistan doesn't have very enviable health indicators. When we talk about infections, about 9 to 10% of our population has Hep C or B. About 40% of our deliveries are still not happening within the health facilities. We have, unfortunately, one of the highest neonatal mortality rates. Similarly, the maternal deaths are also pretty high. And the number of infections as TB is quite high as well. If we, yeah, next slide, please. If we talk about the nutrition indicators, we again are not very well placed. Can I have the next slide, please? In the recent NNS, that is National Nutrition Survey, uh, the last one was done on 2011, followed by 2018, and except one or two things, nothing improved. The stunting, underweight, wasting, anemia, coverage of deworming, all were not very enviable. For example, anemia in women of reproductive age is about 40-45%, along with vitamin D deficiency of more than half of our population is deficient in vitamin D. Can I move on to next slide? Next, yeah. With all these, indicators, it is important to realize that a number of lifestyle risk factors are pretty high, as that is understandable. For example, you can see on the screen that about 40% plus of our population uses tobacco in any form. There is about 65% of urban and 75% of rural populations do not get adequate serving of fruit per day. 90% consume less than 2 servings of vegetables per day. Only 8 to 10% of our population is active, rest are sedentary. Um, Again, very alarming that more than 12-13% of our population has diabetes, and even worse, that most of them do not know that they have diabetes. Same is the case with hypertension and many other diseases. Next slide, please. So we generally have a double burden of disease, which is over time shifting towards non-communicable diseases rather than communicable diseases. Communicable diseases are still very high, but because of these lifestyle and other factors, non-communicable diseases are also increasing, as you can see from the percentage of deaths attributed in the current slide. Could we move on? Next slide, please. Now, how are we addressing this through our health financing system? Uh, we have, unfortunately, 150th number in the HDI index out of 189 countries. And health, there are other factors as well, but health is a key HDI indicator. Um, the government expenditure is not enviable again. 34 the last year the central government health expenditure was 9.7% of the total, and still we have 34% health expenditure by the government and rest by the private sector. One alarming thing is the high percentage of out-of-pocket expenses, which puts poor and the vulnerable at a very extreme risk. The development partners risk is pretty low, as you can see with vis-a-vis compared to many other countries in the region. Next slide. When we compare our per capita health expenditures with the countries around us, it is obvious that we are very low on this index as well. And if we see it in the context of percentage of GDP, again, this percentage is not very good, and it is in many out of the last 15-20 years, it is seldom that we have crossed 1% of our GDP. In this case, it was 1.1% over the last year, probably because of expense which was made on Corona and control of pandemics. Next slide, please. Next slide, please. So, how is our health systems? As you can imagine, we do not have one of the best health systems. It is scattered between public sector and private sector. Public sector has large presence, but very low utilization. With the number of doctors, nurses, you can see there are more than 6,000, 5,000 basic health units in the public sector spread all over the country. The number of hospital beds, though, is pretty low. In contrast, private sector is very large, but very unregulated. Very recently, there have been efforts to control the health sector in a control the private sector in a significant manner, but we are still moving in that direction and haven't yet been achieved. So, as I mentioned earlier as well, that we have a double burden of disease with a mixed healthcare system. Primarily, it's in the public sector, large presence but low utilization. Many issues, and we'll discuss them one by one in subsequent slides. So, can we move on to the indicators? We have an overview of what type of health system we have. So, what opportunities do we have available? And as this slide shows, it's a pretty busy slide, but the purpose is just to show you that there are various levels and opportunities where interventions could be made, may it be
Dr. Asad, we lost your sound actually, voice. Hello? I think there's a signal issue. Parveen, I think Dr. Asad will join back again. So just
Sure.
let him in, and then he will continue. There was a problem, connectivity issue.
Do we want to wait, or should we move on to the panel discussion? I'm just conscious of the time.
Yeah, I think we can move on to the panel discussion. And when he joins, we can hold. And I think there are two more slides which are remaining. So, Zafar, what do you say? I think we should keep on discussing.
I mean, maybe we could go the last couple of slides in case he doesn't come back.
Yeah, when he comes back.
think Dr. Shahzad, because you obviously know the challenges that we have in Pakistan better than some of us, and if you want to just talk to the last couple of slides, perhaps.
Yeah, it would be worth just showing the last couple of slides, I think.
Yeah, I think you can continue. Let me go through this presentation. When he was referring to this model, actually this shows a lot of opportunities where the public health systems can intervene initially at a level even when the risk factors are not there, and then within that, which we call it as a primordial prevention actually. So when we are talking about to promote health and to protect health and to restore the treatment to the health of the sick, and then to maintain health, this framework gives us a lot of opportunities for health system, and specifically a lot of activities are done before the onset of the disease. Next slide. So this is a social determinants of health model which he was referring to. The health is, as you all know, health is not just within the healthcare delivery system. There are so many other factors which affect health of any country, any nation. So socioeconomic context, the economic stability, and of course a lot to do with the neighborhood and built environment, and of course the literacy rate or education. So in Pakistan, we are struggling with all of these factors as well. So we will need more public health interventions so that these sectors can be connected and we can achieve the benefits of public health through these intersectoral collaboration. Next. So this is a very famous, the rainbow model, where we call it a social determinants of health. And if you see, a very small component in this model is just describing this healthcare services or healthcare delivery system. A lot of it is relevant to the socioeconomic, cultural, and environmental conditions, and a lot of sort of other things. I think Dr. Asad is back. Dr. Asad, now can you hear us? Dr. Asad?
Yeah, I can, but I can't see the slides. Or
we are.
Yes, I can hear you. Can you hear me?
Yeah, we can hear you.
Hello, can you hear me?
Yeah.
Shahzad, please confirm.
We can hear you. We can hear you. Hello.
Okay. I'll quickly wrap up now. Can we move to the next slide? And can we move to the next slide, please?
Yeah, it's here.
Can I have the next slide, please?
Yeah, it's next. Now you can see that.
Dr. Saab, can I have the next slide?
We have actually moved on to the next. Parveen, can you see the next slide?
Right. I would like to go on the last slide, actually, just to wrap up quickly, as I understand.
Okay. Next.
Running behind time.
Yeah. Okay. Next. Nahi, wapas aaye. Yeah. So this is the last slide, sir. Where this says the political argument for health and well-being.
Not on my screen. Can everyone else see the last slide?
Yes.
Sir, can you see?
Hello.
We can see. I mean, we can. So we can also.
So maybe its issue is on that side.
Yeah. So now I have that. So.
Maybe Shahzad, you can read through the slide, and Dr. Hafiz then.
Now it's visible to him. I think this is the last slide. Okay, Dr. Sir.
So, if you can hear me.
Yeah, it's clear.
Yeah. So sorry for this disturbance. I don't know, the internet not internet. But just linking up the poor state of health which we have, and the type of the mixed health systems and possible opportunities in this era of intersectoral collaboration. And one of the tools for that intersectoral collaboration is, of course, SDGs and SDG targets. And then we have this experience of COVID management, which was a very transsectoral exercise, which has added a lot to our experience within the health systems, that how we could break the boundaries and work with other sectors. So the first thing which in future we could concentrate on, and that's of prime importance, is the political argument for health and well-being to be a central issue for governments. Unless we could achieve that, and I feel that this is very much a public health function, to elevate the importance of public health and public health interventions to that level, where politicians should go back to their constituencies with their public health achievements for when they're asking for vote, when they're asking for the various seats and the various projects in their constituencies. So this is of prime importance. Unless we can think ways, there are actually documented ways in order to achieve this particular argument. And let me give an example, that if we could, from a public health and technical perspective, if we could break down the indicators to constituency level, to the tehsil level or to the sub-district level, where it feels relevant to the local population as well as to the politicians who are contesting from that constituency, that look, 5 years ago we had these indicators, and now
I think like we lost the sound again. Dr. Asad? There is a connectivity issue. So as you can see, he was discussing about this, a lot of central issues of which revolve around the political discussions. And nowadays, Pakistan is trying to go for this universal health coverage approach. As you know, the whole idea is to cover everybody and everywhere. So access issue is being considered. There are so many models which are currently being implemented, like the GP model, the family medicine, the primary health care strengthening, and of course the Sehat Surat program, the hallmark of this government. There are issues of improving the quality of care and innovative financing, public-private partnership, and a lot of other activities. He has already mentioned intersectoral collaboration and pandemic preparedness and IHR, IDSR. We were partnered with Public Health England, and as you know, a lot of other sort of activities we did with this partnership with the UK partners. There is a lot of concern about, and as you heard the Honorable Minister, the Dr. Faisal Sultan, he mentioned this HR development in detail, with special reference to not just, he said it's not just the physician, actually, the nursing is very important. So a lot of these things, and of course, community organization playing a very, very important role. So that was his whole presentation. And Parveen, we can share this presentation with the audience and with the people after this webinar. We can have this Zafar's presentation and Dr. Asad's presentation, and I'll get hold of the note from the Minister Saab as well, so we can have that, because this is the first activity, and hopefully we will be taking on these messages and making some concrete recommendations for the next one. Over to you, Zafar and Parveen. I think we are now up for the panel discussion, I guess.
Yes,
I saw Professor Zia as well and others. So if you can continue, I'm here with you.
Thank you. Over to Professor Zafar, and he'll be able to take up the panel discussion and introduce participants and however he wants to proceed. Thanks.
I think that's, thank you very much, Praveen. So just to check who's on the panel then, I can see Dr. Sabine Afzal, is that right? I can see Professor Ziaul Haq, Naveed Syed, I can see. Who else was going to be on the panel? Shazad Parveen, I can't.
It's Dr. Shakila Zaman. And the names that you have taken. Please, can we ask those participants to open your cameras so people can see them? Will that be possible?
Okay, so I can't see Dr. Shakila Zaman.
So Professor Ziaul Haq, Dr. Shakila Zaman, Dr. Talib Lashari, Naveed.
I can only see Dr. Zia, Naveed, and Dr. Sabine Afzal.
And we are also joined by, is it Dr. Shazia Shah?
Yes, I'm here. Hello.
Okay, so who's that?
So this is the representative from SIND. So maybe it will be useful if everybody if people are able to introduce themselves by just giving us a little bit of brief about yourself before we do the panel discussion. So,
okay, I mean, if I can just say a couple of things. I think it's been really interesting to look at the health indicators, and that really lays out the massive challenges that the Pakistan public health system faces. And I want to kind of move the discussion onto the public health system rather than healthcare, which we often talk about, but in terms of meeting what kind of public health system do we need in terms of workforce, in terms of intelligence systems, in terms of education, in terms of professional networks. And I think it's some of those areas I'd quite like to maybe get a local kind of provincial perspective on that. So I was going to maybe ask Professor, each one of you to maybe talk a little bit about that, how we can move forward within Pakistan in terms of improving the public health system. But perhaps Professor Ziaul Haq might want to start with that. And then perhaps after that, I could ask Dr. Shazia, and then after that, Dr. Sabine Afzal.
Yeah, thank you, Professor Zafar, and all friends, and it's very happy to see you all here. It's Galaxy of Public Health, and it's very euphoric and feeling and music to my ears to hear about this wonderful field of public health. I am Professor Zia. I'm leading the Institute of Public Health at Khyber Medical University. This is an Institute of Public Health we started back in 2009 in January. So we started with Master in Public Health program, and now we have arranged a program. I was the first one who came back from Glasgow as a PhD, and now Alhamdulillah we have 6 PhDs from US, UK, and other European countries. I'm also a fellow of the Faculty of Public Health. This question, I think Zafar discussed about UK, and then our own Pakistan system was also discussed. So at the moment, what our system is, this is fragmented. The public health system now at the Department of Health, especially after the devolution of the health, and the health is now a provincial subject. We were good, I think we were good before this devolution, but I think the provinces were not ready. So the public health system is now at the directorate levels. So we call it DG Health Office. And there's one secretariat level, which is a health secretary. So all these health secretaries, they are CSS officers, and they are basically in power. So they are the whole, there's a full health secretary, and then there are special secretaries, which should be, and then there are deputy secretary and section officer. Below that is the directorate. So there's a DG Health Office, and then within that section is the different programs of public health. So at the moment, if I tell you the public health system, if any, is there, this mostly run by the donors, by the WHO and other organization. Within the health system, the public sector, that is fragmented and different public health at the moment. So I think this is a starting point which we started last year. So the public in the conference when you came here, so the public health really start after the earthquake. And now again, every disaster brings opportunities. So I think for the second time, so before the earthquake, after second time in the COVID, people start talking about the public health. So this is a very right time. And these are very pertinent questions which you have asked. I have discussed with my students, with other colleagues. And so at the moment, we don't have a system. It's there in many pieces. We need to combine that, and we need something which you have, the Faculty of Public Health, to combine these and make us one public health system. So I will finish by this, and then we can come back to this.
Thank you very much for that, and thank you for highlighting the fragmentation of the current system and possible opportunities to improvement. Now, is it Dr. Sabine is going to go next, or Dr. Shazia? I don't mind.
Sorry, Dr. Zafar.
Yes.
Shakila, Professor Shakila is traveling and she's trying to get in. She called me and said that I will be joining soon. So you can continue with this, and whenever Dr. Shakila joins, we can have her comments. Okay.
I think that's really wonderful news to have Dr. Shakila joining us as well. So I'll just make a choice. Dr. Sabine Afzal, do you want to start?
Thank you, Dr. Zafar, and thank you, everyone. And it's good to be with people. I have both Dr. Shazad, Dr. Asad, and Dr. Shakila has been my eminent teachers. So it was lovely to be with all of them and sitting in this panel. I'll introduce myself a little as a deputy director in the ministry, and my decks primarily look at the health systems. And I'm basically a professional, and I'm an alumni of HSA. So let's come to the topic quickly. Public health system in Pakistan, and like Dr. Saab have just, and everybody has talked about the fragmentation and the issues that we have, a divide between the bureaucracy and the technical people. Saying that, I think the public health system has also evolved over the time. There was a time when people would not look at public health as an important area of consideration, but now they have. And like Dr. Saab said, that every disaster, there is an opportunity. So currently, the COVID has made us realize that we need not only need to focus on the clinical side of the people. We have their shortage. We need to work on that as well. The public health people would working on the epidemiologists, the field epidemiologists, the laboratory people. That focus has also come up. And currently, before the COVID, there was a thinking, and we have developed, the ministry has developed a health human resource strategy, and within that, we were looking at assessment of people to meet the IHR capacities, and assessment of looking at the people in different areas of public health, where what is our current production, what is needed in next 5 to 10 years, and how can we be able to achieve that. So that assessment is still going on, but the COVID came in, so said that's why it was delayed. But I think when I was looking, and I was asked to be part of this area because I was interesting to see how other people look at. I think Pakistan need to work within the system, realizing its potential as well. We always say that we are fragmented, we are this and that. Sure, we are there. We have a public sector where it's have limited resources, but at the same time, our public health people, especially at the provincial level, does not have the capacity to spend whatever they are given in time, because of the complex financial system. When we look at why bureaucrats work better than us, because they have pre as well as in-service trainings. We do not have pre-service training when it especially come to the management side, the financial sides of public health. And that's why they somehow beat us to that. So we need, when we put public health professionals, especially the management cadre in the public health sector, we need to give them at least a 1 month or a small training of how to deal with the government, especially in government or any organization, pre-service training. So they are able to know the rules, regulation and things and how to use them to the maximum benefit. People don't have that capacity, and they always learn as a hand-on when they had to go through these processes, especially when it comes to rules and regulations. Current reforms that happen at the government, the focus is again, the PMC now is focusing on the clinical side of the people and is not looking at the public health or the management or the basic science. That part they have given it to HSC. So HSC is at this point does not have capacity. Probably they will develop it very quickly because they are higher education commission, but a dedicated faculty to regulate the public health system in Pakistan is not there. And there should be a system of in-service training at the same time. Very small courses, but they should be made part of, like bureaucrats have, SMC, MMC, MCC, जो वो mid-level trainings करते हैं, and then they get promoted on the basis of those training. And similarly, government has to make a career structure of people so that people look opportunities while working with the government. When we train people, good people, we lost good people to the development sector or to the international post, because they don't, at certain time in time, after 10, 20 years, they don't see any career opportunities within the system. So if we look at these small little things, if government can just do without just changing a little bit of rules, recruitment rules, promotion rules, these things can be improved without putting a lot of money in it. So, but it will bring a long-term result and will bring a better improvement in the health system. As a result, service delivery or other aspect will improve eventually. Another thing I've just, and then I'll stop, is that the public health intervention are not tangible intervention. Politicians find it very easy to cut a ribbon in front of a hospital. But how you get a ribbon when people are asked to wear a seatbelt? So this kind of an attitude, this kind of understanding and advocacy is needed. That if you put your money on the preventive side, you'll save a lot of money. I'm not saying that we don't need hospitals, we do not need clinicians, we do, but we can save a lot of money. If you could have to tell them in monetary fund that how much a small intervention, one drop of polio or 2 drops of polio can do when you put a child, prevent a child from a disability and lifelong burden on the health sector. I'll stop right here. Thank you.
Okay, that was really wonderful and a really interesting insight into the Pakistan public health system. You covered a whole range of issues from workforce, and I'm really pleased that you mentioned, it is not just the public health specialists. There's a whole range of people working in the public health system, from lab workers to epidemiologists. And you talk about the career pathways and doing so, and regulation, and maybe doing some kind of needs assessment around the public health workforce and the really importance of prevention. So thank you very much for that. If I can just pass on to, is Dr. Shakil Asman on the line yet, Shazad, or not? Praveen?
No, not yet. Not yet.
Okay.
So
in that case, I'll pass on to Dr. Shazia Shah. Please welcome. If you could introduce yourself, that'd be great.
Assalamu alaikum. My name's Dr. Shazia Shah. I was born and raised in the UK, and I basically trained there at Guy's and St Thomas's, and I have my MRCP. I'm a consultant internal and respiratory physician. I moved back to Pakistan 3 years ago because my husband's running a hospital here, and he's an MPA here in Sindh. I was saying to Parveen privately that I'm not sure I'm qualified to be called a representative from Sindh. I'm very, very interested in the clinical side of healthcare systems and healthcare delivery, but I don't know that much about academic public health, obviously, and what the structure needs to be. I was really interested in what Sabine was just saying, and all those pointers about the interface between politics and public health. That's very, it's very true. And I think one thing that we do know here in Sindh, and I hate to sort of bring politics into it, but it is obviously an important part of public health, because my husband receives these audit documents, and there's a lot of wastage. There's a huge budget for public health and healthcare delivery here in Sindh, for example, and there is a whole bunch of money that is completely unaccounted for, and that's shocking and wasteful, and that's something that we really do need to get a grip on somehow if we're to move healthcare forward in this country. And just from the clinical side of things, I think just quickly, because I'm working as, I did a COVID diploma early on in the pandemic from the London School of Hygiene and Tropical Medicine. And just from that point of view, I've been seeing a lot of COVID patients because I have a respiratory background, as I said. And I think two things that became very clear, and I think we do need to address here in Pakistan, is that one, we need to really tightly regulate medicine availability here, because I think people can just pop antibiotics, steroids, very powerful medication without ever seeing a doctor, and just based on what they've read online or what they've been told. And then it's very hard to intervene for any clinician to intervene at that point when everything's been done and possibly not been done to any standard. Secondly, I think, you know, we have got guidelines for coronavirus and many other diseases here, the same as we have in the UK. We have nice guidelines for things. And I feel that that's a great place to start in order to standardize healthcare, whether it's in the public sector or the private sector. But we don't seem to be applying those very often or referring to them as a profession. And that I find something that we should push. If we are making the guidelines, if we are writing them, then we should be asking our doctors to stick to them. And thirdly, I think we really, really need a death registry in this country that is compulsory. We need everyone who dies to have a cause of death written on their death certificate. And I do really think that's very important. We need to know what is killing people, so that we can plan better and make healthcare policies according to that. I'm always very shocked when I can't see that in my patients. And that's what I have to say. I'm sorry, I moved into the healthcare systems and delivery. I know that that's not the focus of this talk.
No, thank you. Thank you very much, Dr. Shazia, for sharing your kind of perspective as you've come in fairly recently into the Pakistan public health system. So, and I think, you know, good governance is good public health. And certainly, you know, having good epidemiological data on deaths is absolutely critical to developing good kind of public health systems. So I think your insights are really valuable. I just wondered whether Dr. Shakil Azman is still on the line, Parveen Shahzad. If
no,
not,
I'm still struggling, I guess. Yeah. So you can ask Naveed, maybe.
Yeah, I was going to ask. Naveed, if you could introduce yourself and maybe, you know, give your perspective, as you worked in Pakistan for about a year, and again, you've got that perspective from outside as well and from inside.
Yes, Jazakallah khair. Thank you. So I'm Dr. Naveed Sayed. I'm working as a consultant in health protection here in the UK for over 15 years, but I was working in for the last couple of years in Pakistan on the surveillance systems and strengthening the international health regulation contribution of Pakistan for, as I say, for the last couple of years, working alongside some of the colleagues on the chat. I mean, I think it's been a really good discussion, and some of my thoughts will incorporate what's been said, and certainly from sort of Faisal's first sections where he talked about the need for reform, the need for a coordinated response, and he also mentioned the importance of having good quality data. That's something that's a recurrent theme. Christian also mentioned the importance of good quality systems, epidemiological data, and good data and investment, and targeted investment, which again, it's another theme that's coming through. Dr. Asad Hafiz again talked about the importance of data, local data being very good in terms of driving the healthcare system, the healthcare delivery, and prioritizing health and well-being for the local population. And he also mentioned, which was really good to hear, the importance of a good quality systems. So good quality healthcare, good quality public health. And again, some of these themes are coming through. And for us as professionals to own the system and to be quite clear in terms of what we want. Obviously, we've got an opportunity through COVID where people are focusing on public health, and that's what Zia also mentioned in terms of we have had a fragmented system, but there are opportunities to develop the system and bring things together. And I would like from yourself, Zafar, to sort of help bring those strands together, and some really great points from Sabine, who's got a very good insider view from the ministry perspective, looking at the difference between the bureaucracy and the technical aspects, but the importance of how we evolve public health in Pakistan, which is again why we're here, bringing together the experts like she mentioned, and that's part of what we're doing. We do recognize the limited resources and a resource poor environment that Pakistan is. And as I mentioned, it's less, about 1% of GDP, which makes it even more important that we prioritize spending. But I was really, really pleased to hear the importance of what we would call continuing professional development or on-the-job training, that Sabine mentioned in terms of helping refocus the priorities in terms of how we can deliver health and how we can deliver public health better. And certainly from yourself and others on the line, Professor John Middleton, we can bring a lot in terms of supporting the development of the workforce, supporting the development of systems and structures around professional development, and something that is necessary at the local Pakistan level. And again, Shazia talked about visibility, transparency, and making sure that we've got the right data and we're focusing the efforts appropriately. So all of those things were really important. But again, a few key things there came out from the discussion is around the importance of good quality data. And I think we can sort of work on how we can take those challenges forward, and how we can make that information useful for policymakers, how we can make that information useful and relevant for people on the front line. So I think these are some really key things, because we all recognize that there's an incredible amount of talent in Pakistan, and some of us from the UK and the diaspora, we're here to help and support, but it really needs to be led locally and have that commitment to public health. So the return on investment that a lot of the speakers have been talking about, it's a no-brainer in terms of public health. So I'll be really keen for people like Sabine and the others on the panel, Zia, where we think we can focus our efforts moving forward on the back of public health systems through COVID, as in what are the next steps?
Thank you very much, Naveed. I think you've summarised the whole morning, the whole session really well. I think we've had a really good discussion on what the problems are in the system. We've got a really good analysis of what the solutions might be. I think the difficult thing is, how do we get from A to B? How do we get from where we are now to where we'd like to be? And I just wondered whether we've got enough time, maybe just to ask the panel members, how do we do that from A to B? We've had lots of offers of support from all. On looking at the chat, we've had an offer of support from John Middleton in terms of the European Association of Public Health, and there's often there's support that they can give us. There's Upsign support. There's the UK Faculty of Public Health support, and I'm sure there's support from elsewhere. But it's a question of how do we get from A to B. Anyone like to, Sabine or Shazia, or anyone would like to, or the Professor Zial Haq, anyone would like to say how do we get from A to B? Maybe one thing we need to do.
So just to interject, Professor Iqbal, I just also, while you're asking people, that one of the things which we all know in Pakistan is that we've got, in terms of public health professionals, we've got quite a lot of trained force, which is very multidisciplinary. So we've got doctors, we've got nurses, we've got pharmacists, we've got occupational therapists, and you name it. These are trained public health professionals with at least a master's degree in public health. So maybe your panelists can also think of how can we actually bring these sources together. These are untapped ones. How can we actually make sure that they can contribute to it as well? Thank you.
I think that's a really important point, and I think Dr. Sabine Afzal made that point about the family of public health professionals is actually very large, and we need to think about the whole family, from the full range of public health professionals who can contribute. So, anyone would like to say anything about from
Dr. Zafar, may I think being a government person, I always look at the financial liabilities and things like that. How can diaspora can help us, and how anyone can help us is that when I talked about the in-service training, I think we can easily develop small online courses of continuous development, and these courses can be then registered with the Pakistan Medical Association or Higher Education, Pakistan Medical Commission or Higher Education Commission. So when people go for the renewal of their registration, this concept is very new in Pakistan. People are still struggling with it, and the idea of CME is still in infancy. So if you look at the CME or CPD ideas, these can easily be done online courses, because in COVID, they worked very well. We had online courses even on clinical side, where people who were already working in ICU were given online trainings and things, and they were performed very well. So, so people know their work, but when they get a little bit systematic, I think they can improve their performance, and that can be a continual process. And this is where diaspora can come in. They can already working use those online small courses, and people can easily do it, because I think one thing Pakistan is very good is internet and mobile. Everybody has a mobile, everybody has an internet connection. It may get unstable at time alert, but this is something where we can do very easily. Increasing health budget is something that we have been struggling with. We are still fighting for it. And then we have to look at how the financial management system can be improved. But this is something, a policy level thing, I think, not at this point in time, but this is something we can look at it, how the financial management system can bring efficiencies. What we need to do is that when I saw everybody want to help in COVID, they want to help in same thing. So it's the responsibility of the government or the receiver is to make sure that the duplication and the double dipping is avoided. And with COVID, we tried that and it has worked. We have divided, okay, we need 100, let's say, PPs. We have money which is for 60 coming from source A and 50 from B, and let's divide and put it right. And then we did assessment, and we, like Naveed keeps saying that, and about the data, I think government is fully committed to develop a digitalization of the data. So having what we have and then build on what we can do, this is something I think we can take us from A to B. It's a long journey, it will be a difficult journey, but we have to take steps, and we start moving, then eventually we'll reach there. Thank you.
Okay. Anyone else from on the panel wants to say anything about A to B, or any of the other questions that have been raised on the post, on the chat?
Can I just ask how much public health is taught? Oh, sorry, Professor.
If you maybe let Professor Zia speak.
Yes, of course, sorry.
You can carry on, yeah.
Oh, it's okay. So
okay.
I think on to yourself, Dr. Shazia Shah. I think he wants you to speak, Dr. Shazia.
Okay, I was just, I think the same point what Dr. Shazia said that about the curriculum. So I think if you could start from the curriculum, I think we started with you, Zafar, and your team, Samia, the curriculum in the undergrad curriculum. that is the MBBS curriculum, and also the allied health sciences, the nursing, paramedic. This is relatively easy because now it's the responsibility of medical university. I'm leading a medical university. I'm the vice chancellor now of the Khyber Medical University as well. So you could just see again, there is a community medicine called community medicine in the public at the 4th year. But now we are moving towards modular systems. We want public health to rightly start from the 1st year to the final year. We also want to change the name from the community health to public health right from the undergrad. So this is something we need to work together and to see, to compare our curriculum with what you are teaching at the UK and other modern and developed countries. So the same not only for the medical, but now it's also for the other allied health sciences. It's now relatively easy because before it was the Pakistan Medical Commission, the then PMDC, but now they were given this responsibility to medical university to have their own curriculum. So it's an opportunity we need to exploit and to see what we can put into the curriculum. Master in Public Health program, but the curriculum is not uniform. If you come up with the curriculum, everyone has its own curriculum of the Master in Public Health. So if we see the people coming into the market, so we need to look into the Master in Public Health, MEC Epidemiology, and see what the curriculum is. I have added another program that is BS Public Health. This is very exciting stuff. I'm very excited about that as well. So I started it from my own university at Khyber Medical University. This is now an approved program at the Higher Education Commission. We offer it for the first time in the KP. It's a very exciting program in which we want people who are only public people. So this is a BS public health degree that is coming up. So I also need help in there. And then at the health system, I have just put 3 things. One is we need family practice support. We started, there's no referral system, all burden on the tertiary care, but we can start this family practice approach. For that, we all are doing efforts, but we need to combine and we need really to push that agenda of the family practice approach. This health insurance, now the KP government said that everyone will be covered. So if you can just emphasize how the data works and that as well. Can you hear me?
Yeah, we can hear you. Yeah,
Yeah, we can hear you.
Hello?
Yeah, we can hear you.
We can hear you.
And so my last point will be Okay, so my last 2 points will be where the public health should be placed. At the moment, it is only at the Department of Health. We have other departments like Halal Food Authority. We have public health engineering. I think we should come forward from the health department and we should start thinking about where public health should be better placed, because we are only there at the receiving end. And the last point is how we recruit and how we appoint our DHOs. We call DHO, the district health officer. You call them the directors. They are the key people. They are the key people who are the district health management team. If we start picking them from the market, I think this will change the thing. So I think these are my points. Thank you.
Thank you very much, Professor Zia, for sharing your personal experience from there.
Thank you, Zafar. I think Dr. Shakila could not join, but we can see a hand raised from Memuna. If you can ask her, please.
Yeah, I was gonna pass on to Memuna actually, because again, Dr. Memuna, if you could just introduce yourself, that'd be great.
Thank you very much.
She knows Pakistan a lot.
Thank you very much. It was. I congratulate all the speakers for their commitment, but also their very valuable thoughts. My question and my comment was going to relate to the comments Dr. Zia made and Dr. Sabine made. And I wondered, and it's also links with Zafar's question about how do we move from A to B. I think it's a big problem and it has to be eaten in chunks. We need to eat the elephant in chunks. And I wondered if public health registration and accreditation is something that could be taken, and it links with the curriculum. We started with the curriculum for undergraduates, and whether there is a body or whether Pakistan has a body that actually registers all the public health professionals. If you wanted to know who is public health trained or who's public health qualified, where would people go? And then signing them off and accrediting them so that when the jobs come up, that could be a requirement. You know, it's almost like Faculty of Public Health's contribution. So that's the question I have. And Zafar, I would really like advice from our Pakistani colleagues on how to take that forward.
Thank you very much for that. I think that's a key component of a public health system. I'm just going to ask Dr. Shahzad, because we're running a little bit late. I think we're due to finish at 11, aren't we? I'm just wondering whether you might want to wrap up in terms of, because we've had a really good analysis of what the problems are. We had some fantastic ideas in terms of solutions. We haven't got a clear path from A to B though. So, and we may have to take in chunks at a time, as Dr. Mamouna said, small bits at a time. So how do we do this? How do we capture all the amazing discussion we've had today and convert it into action?
Yeah, thank you, Zafar, and thank you, everybody. Actually, today is just the start of this kind of discussion on public health, exclusively for the sake of public health development in Pakistan. Dr. Asad, Dr. Faisal, and many other colleagues already mentioned there are many success stories in Pakistan when it comes to disease control or health system interventions. But there are some infrastructural, as well as you can say, institutional level requirements. We need proper institutions, proper public health systems, which is the need of the hour. So the today discussion, I don't think we can answer all the questions which were discussed over here. So if Mamouna was talking about the registry of public health, we have the registry of public health at the level of production. So HSA will have its own registry which can be made public, or we can put it into some HRH registry. Similarly, Lahore IPH has it. There is no central public health registry. The very good point. We can have that kind of registry where anyone coming into the public health system can be followed up. Number one. Number two is a lot of other discussions specifically on nutrition, maternal newborn child health, and social protection, and a lot of other areas were discussed. Actually, we had been doing such seminars in different settings. So the nutrition group will come and talk about nutrition. The MNCH group will talk about MNCH. And similarly, NCDs and heart disease. In the morning, I was in another discussion where we are establishing a state-of-the-art national institute for prevention of cardiovascular disease and research by the name of NIPCARD. So we are integrating that network into all the cardiac institutes in Pakistan. So we are having a daily basis linkages and interviews with all the institutes of heart disease. But the focus is on prevention. So, but we need a lot of discussions that how all of these, you can say, fragmented pieces of public health interventions, which are disconnected from each other, but how we can bring into a mainstream public health system. So that is, I think, the take-home message should be for today, as well as for future as well. It should not be based on individuals. It will not be based on people of like fame or experience or position. We need to develop an institution where anybody, if it is coming into that institution, he or she will be contributing towards public health system in this country. So that should be the aim of that public health system. You have a very good example of Public Health England, and you have an example of Canadian public health system, and a lot of other institutions around the world. So I'm happy that we just, whatever few of us thought, and we started this discussion rolling out, and now the questions are adding. I'm not afraid if the questions gather more than the answers. Initially, you have to have a lot of questions, and then you can take one, like you mentioned, when you take piece by piece, and you can go on into a sort of a proper public health system. We are very far from that from now, but you have to start. We have to start from somewhere. So given this lot of high-profile people coming in. I think it was very good to have that. And Zafar, I think you should be, now you or Parveen should be, because now people have, I think they will start leaving. So you can tell them what would be the agenda for our future. Yeah, so how would we take this discussion forward? Zafar?
I think, I mean, clearly, as you've said, there's a lot of questions being raised today and some really good answers as well. But we need to map out on how we're going to get some kind of national and local implementation plan. So, I mean, maybe one of the ways forward could be we could have a look at each of the provinces and look at the public health system within each of the provinces, and that could be one way forward. Another thing could be we could have maybe a national task and finish force to look at the overall public health framework, looking at the very wide range of issues, and maybe picking off some one or two priorities, because there are too many issues to look at. That could be one way forward, really. So I think possibly, Dr. Shahzad, maybe we could have a discussion with some of the senior speakers we had online, and maybe agree a way forward with them. So I think this is just the start, but we need to agree the way forward with the current leaders within the Pakistan public health system.
Yes, I think that would be a good idea. Parveen, anything from your side?
Sorry, I was just trying to unmute myself. No, thank you so much. I think this has been a really useful discussion, and I think there is a clear need for discussions about public health, and also to bring people at the same level, because one thing we also need to understand is how is public health seen. So it's not that public health, the concept of public health or the concept of prevention is not there in Pakistan. It's used slightly differently into the undergraduate nursing, medicine, and healthcare subject fields. So it's more known as community medicine or community nursing or community health nursing, and we've got a very wide workforce working under that in various different roles in all provinces. So I think the idea is to how can we actually bring all of that information together to be able to then understand that, what Memuna said earlier on, could there be a body which registers people with public health qualification, and what could their role be? But the last thing which I would like to highlight is that we do have qualifications and we do have qualified people. What is lacking as the infrastructure and the career structure for these people as to how and where they can contribute from their knowledge to improve the system. So I think unless we work on that, in addition to everything else, nothing is going to work. So I think that's something that we need to think about. Maybe the next step should be that, as Professor Iqbal said and Dr. Shahzad said, that we need to come up and summarize the points that we learned from this discussion today, and perhaps put people together from different provinces as well as from different disciplines together to come up with a plan, and then can continue to carry on discussions and see what's the where we are going from here. And we from Upsign would be very much willing to help and support any endeavors, and colleagues would be able to link you up with other academics, other colleagues working in other disciplines, not necessarily only in medicine or health related subjects, but let's say like the agricultural side or animal sides, because all that come back to offer or contribute to the public health environment in any country, and we can just take it up from there. Thank you so much. Thanks a lot.
Yeah. Okay. Thank you, Parveen. I see a hand raised from Dr. Khalid. Just quick remark on holistic approach. And Dr. Rosina, if you want to add something, or Dr. Faiza Ramani from IPH Lahore.
Let's start with Khalid, and then we go to Rosina, and then
Khalid, please.
Thank you so much, Dr. Shahzad. I would like to congratulate the team here today. Am I? Oh, yes. The team here for the fantastic discussion today. And as just Dr. Parveen said, I think it's a need for having a holistic approach. And this problem is not a single approach. See, there isn't a silver bullet to solve all the problems. I mean, you mentioned the issues early morning. Somebody said the diabetes in Pakistan, this increasing trend is very much linked with our food diets and patterns. So what do we eat in Pakistan? We eat wheat primarily. And the wheat that we eat is low in fiber. So the only thing the breeders care is that they are in a race to get a wheat variety which is high in yield. They are not looking at fiber quality. And this is where I think we need to look at those sort of aspects. Issues around zinc, iron, those deficiencies, again, we just have seen those issues come from these deficiencies back in the soil. And the issues around zoonotic diseases that come from livestock to humans. So I think we need to have some kind of the system approach, system thinking. So it's very much interlinked. And I think it's a good time to start those discussions. I just want to say that. Yes. Thank you so much again for hosting.
Thank you, Khalid.
Thank you.
Dr. Rosina.
Thank you so much.
Yeah.
Thank you so much, Dr. Shahzad and Parveen. I think this is fantastic initiative. Everybody's appreciative. Excellent presentation, good kickoff with good committed presentations from the key leadership in public health. As a next step, I just wanted to say that there are great questions on the chat. And if we can pick up those questions and divide them into themes, and then if the smaller groups can pick up according to their interest. So perhaps we can make themes with teams. And with the concept of themes with teams, we can bring up our next webinars around themes with teams, and then see how we can bring the prevention and the risk reduction with the holistic approach, systems approach, and multidisciplinary interprofessional approach with good institutions also, keeping in mind that people come from there. So thank you for the opportunity. Over back to you, Dr. Shahzad.
Thank you, Dr. Rosina Kamjani. Dr. Faiza Rabbani, if you want to say something. Is she here? Dr. Faiza Rabbani. Okay, Parveen, over to you. I think we are near.
Yeah, thank you. There was one person, Dr. Mirza, I think somebody, and he wanted to say Dr. Mir Zafar. Is that
okay? Let him say. Dr. Mir Zafar.
Please unmute yourself.
Assalamu alaikum.
Assalamu alaikum.
I'm Dr. Mir Zafar. I'm occupational health specialist practicing within Pakistan, Karachi, dealing mostly with the occupational health diseases in the industries and the public places, especially the oil and gas sector. So I run an organization with Eco Pakistan, developing awareness among the people about public health and disease prevention. I'm also working with Yarane Watan. That was a brief introduction. What I was saying, public health being focused within Pakistan is a very good webinar being conducted by Zafar Iqbal. In fact, disease prevention should be focused more so that there will be less load on the health. And secondly, the health management system, the record keeping of diseases, especially it could help. The occupational health can help the employers and the people who are working. Mostly 80 to 90% are employed people. So to begin with the public health awareness, the employers as well as the institutes can make people aware about the disease and disease prevention. So with the disease prevention, we can reduce the health load on the health system. That's what I want to share.
Thank you. Thank you ever so much, everybody. And Shahzad, I think we can conclude. We are already over time.
Okay, thank you. On behalf of Health Services Academy and all the partners like Faculty of Public Health, Upsign, Yarane Watan, and all the speakers, I think we had a very, very, very good session. We wanted to start this discussion on development of this public health systems in Pakistan. Like I mentioned already, it's just the beginning. We will be holding such discussions in smaller groups and some webinars to more sort of open discussions. Like Naveed has written in the chat box, if anyone is interested to join us in the future discussions, please put in your names over here and we can have this chat saved and develop this for the future agenda. I'll request all of you to keep in touch and do submit whatever your feedback and discuss, because the time was limited and we actually had a sort of a very so you can say limited points discussed here. Public health is such a broad field. So hopefully when your discussions and your points will come to us, we will organize them into some form of a brief. And like you saw that when I told Dr. Faisal, and he was very happy to see that we will be submitting a sort of a brief of this discussion to the Honorable Minister, and hopefully then we can move on to the provinces so that we can have provincial level discussion. So thank you very much from my side to everybody, and thank you, Parveen, for all the hard work of this IT plus designing and everything. I think Zafar, if you want to say thanks, over to you, and then Parveen.
You're mute, Zafar.
I mean, just a big thank you for you, Siddharth, for pulling together such an amazing set of speakers together. And again, thank you, Parveen, for making it happen. So we'll produce a report following this, and then we'll take this forward. We'll show the report to the ministers, and we'll agree a way forward on this. So thank you for everyone's contributions, and please put things on the chat, and we'll use those ideas and feed those into the report. So really very grateful for all the contributions that are being made by everyone in the chat. Thank you.
Thank you, everybody. Can I please request the speakers and contributors on the webinar to stay online, and if everybody else is, thank you so much for joining us, and we will look forward to hearing from you about hearing feedback from you all. Thanks a lot.
Fantastic. Thank you, everyone.